Download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues. I'm Mr. Zaman. Let's look at today's top headlines. The National Medical Commission or NMC has issued the academic calendar for the Bachelor of Medicine, Bachelor of Surgery MBBS program. As per the NMC's academic calendar 22-23, the classes for first year MBBS batch will be conducted between November 15, 2022 and December 15, 2023. The students will be taught anatomy, physiology and biochemistry in the first year of the professional course. The second year of MBBS program will start on December 16, 2023. The Medical Education Department on Wednesday evening claimed that 85% of the striking resident doctors have resumed duties after talks. Reacting to it, the Jaipur Association of Resident Doctors or JRD alleged that the state government was creating a divide for weakening their agitation. JRD spokesperson Dr. Chitresh Shekhawat said they have not called off the strike and will intensify their agitation by boycotting the emergency services including ICUs. Medical Education Principal Secretary Vaibhav Galria said that they mutually agreed on demands of the resident doctors, following which the resident doctors have resumed duties. For the 2020, 2021 and 21-22 batch candidates, the state government has reduced the service bond amount from Rs 25 lakh to Rs 10 lakh and the duration of the service will remain 2 years. Indian authorities have halted production of cough syrup at a factory of Maiden Pharmaceuticals, the state minister said on Wednesday, after a WHO report that the medicine may be linked to the deaths of dozens of children in Gambia. The health minister in Haryana state, Anil Vij, told media that authorities inspected a Maiden factory near the town of Sonipat in the state and found 12 violations of good practices. Production was ordered stopped. In an attempt to increase the revenue-generating potential of the Delhi-based AIIMS or All India Institute of Medical Sciences, the fee structure of the Premier Medical Institute is likely to witness a revision and it may now get modeled along the lines of IITs and IIMs. Such a recommendation was made at the Chintan Shivir of AIIMS held back in August 2022. In this regard, an official source in the Health Ministry has informed media that the ministry is in the process of finalizing a committee which will study the feasibility of these recommendations and see the level of increase that can be done. A review paper published in the Journal of the American College of Cardiology examines the potential drug-drug interaction or DDIs between Paxlovid and commonly used cardiovascular medications as well as potential options to mitigate severe adverse effects. Paxlovid received emergency use authorization from the US FDA in December 2021 as an oral antiviral agent for the treatment of symptomatic, non-hospitalized adults with mild to moderate COVID-19 infection who are at high risk for progression to severe disease. Now, patients with heart disease and other risk factors including diabetes, high BP, chronic kidney disease and smoking make up a large portion of the high-risk population for whom Paxlovid is beneficial. A number of studies have suggested that eating a healthy diet may reduce a person's risk of dementia, but a new study has found that two diets, including the Mediterranean diet, are not linked to a reduced risk of dementia. The study is published in the online issue of Neurology Journal. The Mediterranean diet includes a high intake of vegetables, legumes, fruits, fish and healthy fats such as olive oil, and a low intake of dairy products, meats and saturated fatty acids. It's estimated that upward of 70% of women experience hot flashes sometime during the menopause transition. Although it has long been accepted that hot flashes can affect mental health and quality of life, accumulating research suggests a link between them and cardiovascular disease risk in women. Cardiovascular disease is the leading cause of death in women, with the risk accelerating in midlife during the menopause transition. Large epidemiologic cohort studies as well as clinical studies using physiologic assessments of vasomotor symptoms have produced evidence linking hot flashes and risk of heart disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.